Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 231 of the Ask Dr. Angela podcast. So I just gotta tell you, my arms, my chest, my ribs are so sore. We hung out over a friend's this weekend past, and part of the festivities, besides pooling and eating, love grilling out, was a friendly game of cornhole. We each, it was two couples, myself and my wife, my friend and her husband, and we were on opposite teams. So my wife was on a team with our girlfriend's husband, and I was on a team with our mutual girlfriend. And we just got our butts kicked. And they just talked so much shit. It was just like crazy. And I'm super competitive and I hate to lose, but they killed us. But we're gonna get them back. But anyway, just from throwing those miniature beanbags at such a great distance really took a toll on my arms. And I really felt it the next day. And just when I thought that cornhole was a Midwestern thing, we certainly played it out east in the Garden State of New Jersey this weekend past, and a good time was had by all. So jumping right into today's question, every day that I'm in the office, I see a handful of postpartum patients, and certainly one of the things that we discuss at the 6-week postpartum visit is contraception. What are you going to do for birth control? And so one of the questions that I was recently asked was, how soon after giving birth can you take birth control? That's a really good question. Typically, in my practice, we don't even talk about birth control until your 6-week visit. And that's primarily because until your 6 weeks post-delivery, you were still at an increased risk for clotting. Pregnancy in and of itself puts you at an increased risk of clotting, and that's just due to the hormones. But that persists and remains true until you're at least 6 weeks out. Having said that, it's going to be really physician dependent. I remember being in residency and working with the clinic population, and we used to give patients progesterone-only birth control, specifically in the form of Depo-Provera, prior to discharge. And this was for patient convenience, or sometimes in patients that weren't very reliable for follow-up, we would give this to them. And I know that recently there's been a few articles that I've read, and perhaps a move to, start inserting IUDs postpartum or post-delivery prior to discharge. I personally don't do that in my practice. I know that the flip side of that, there's some concern of increased risk of expulsion. So I'm not really sure where the college stands on that, or if it's just provider dependent, which I think that it is. If it's a progesterone-only form of contraception, whether that's Depo-Provera in the form of an IUD, or perhaps even a progesterone-only OCP, I suppose that would be okay. But again, typically in my practice and in my practice's practice, we don't initiate contraception until you are at least 6 weeks out due to the reasons that I've previously stated. So hopefully that sheds some light onto that situation. That was a really good question. I think that question actually came to me from, again, a media outlet, and we get asked so many questions by the media on a daily basis. I feel like I'm answering at least one, sometimes 2 and 3 questions from various publications on a daily basis. If you have a question that you would like addressed, or if you have a topic that you want discussed, you know how to reach me, www.askdrangela.com. That's where everything that you need to know about me is located. It's my website, it's my social media venues, it's the YouTube channel, it's my blog posts. I have been hearing from you via all of the aforementioned, and I love hearing from you, so keep those queries coming. In closing, I would like to leave you with this, and this is from Life's Little Instruction Book. That's one of my favorite books for quotations. But anyway, it says, never criticize the person who signed your paycheck. If you are unhappy with your job, resign. I love that, because so many of us are not satisfied with our current station in life. And I always say, initiate or be the change that you want to see. Ponder on that for a bit. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 232 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.